One of the biggest marketing opportunities for the Regain Memory 360 program is understanding the physician billing codes and the opportunities that physicians have to bill. In this video, I want to walk you through some of the CPT codes that are provided on the billing code cards and also the dementia care plan and how to walk a physician through this and thoroughly understand it. Here's a copy of the CPT billing code for Regain Memory 360. Each of you guys have these. They're an index card size to give out to your physicians. If you don't have any, please get with your ED. Something I want to walk you guys through is understanding the difference between a CPT code and an RVU. CPT codes are used by physicians who private bill. And what I mean by that is they're not in a big hospital group. They do their own private billing. So they will bill the different CPT codes shown here, and the reimbursement rates for that are to the right. The one we're going to focus on today is the very bottom, the 99483, with a reimbursement of $220 to $260. Now, what's the difference between a CPT and an RVU? Well, physicians who work in a hospital group don't necessarily get reimbursed that amount. Even though they'll still bill that CPT code, the hospital usually gets that reimbursement. So those physicians don't necessarily care as much about what the reimbursement is. They care about RVUs, and those are numbers that they get bonused on. So the RVU for the code 99483 is 3.44, and that's a high RVU code. So physicians are going to be very interested in billing for this because either they're billing the CPT code and getting reimbursed between $220 and $260, or they're looking for that high RVU if they're in a hospital group of 3.44. So what is this code 99483 for dementia care? So what is this code 99483 for dementia care plan? Well, dementia care plan normally takes a physician a lot of time because it entails a lot of information regarding the patient. The good thing about the Regain Memory 360 program is the dementia care plan is already built in. So physicians don't have to enter all this information. A lot of it's already entered for them. The physician or somebody in his office can easily log in, and it takes between 3 and 5 minutes per patient to do the dementia care plan. And once these physicians know that there's something they can do that only takes between 3 and 5 minutes, and they can get reimbursed between $220 and $260, you're going to have their full attention. So the next thing I want to do is walk you through how to show a physician how simple it is to do the dementia. I encourage you guys to take either a computer with you, a tablet with you, and that way you can walk either the physician or someone in his office through how to do the dementia care plan. It's super easy, super simple. You'll have a demo login, and this is how you do it. You go to regainmemory360.com. And once you're there, at the very top right up here, you'll see Login to Mobile Leica. From here, you're going to select the type as Physician Login. And your demo login is going to be physician25, the @ symbol, stat.com. And the password is all lowercase together, demo, DEMO 123. And physicians are given their own login, and when they log in, they can obviously search and see their own patients. This is just the demo account, and we're on a test patient right now. But this is exactly what a physician login will look like. So whenever they select a patient, they can see all the biometrics for every day our clinician was in their home. But to do the dementia care plan, that's over here, this one right here, UCAP 99483. And by clicking on that, you'll see up here at the top where it says Add New. They'll select that. A lot of it's already filled out for them, so the patient's name, date of birth. And then further down, you'll see there's the different biometrics that they'll enter for that day. They'll do a clinical evaluation, and a lot of this information down here will be already entered for them. So our clinicians do PHQ-9, GAD-7, Epworth, MOCA. The ADL score will be listed for them there. Then there's some questions the physician answers. Are they fall risk, their driving safety, medication management, a few others. They'll enter the diagnosis and any comments they have, and then all the other information has already been completed for them. So what would normally take a physician, well over an hour to put together for a patient to be able to bill for a dementia care plan, it's already all built in here for them. So they'll simply enter their password again, and that's their electronic signature. So once they hit submit here, it's going to be a PDF document. So they can either save it as a PDF, they can print it to send to Medicare, however their office does it. This takes between 3 and 5 minutes, so it's super simple, super easy. And whenever you let a physician know that there's something they can do that takes such a short amount of time per patient, and they can get reimbursed between $220 and $260, you're going to have their full attention. So this is a huge marketing and selling point for you guys. Not to mention just being able to have a physician log in and be able to track your patients and see all their details of, what their biometrics were for the day that they were in the home and what their cognitive ability, how they've progressed and improved. So make sure you guys are using your CPT billing codes, and also walk physicians or someone in their office through how to do this. If you're not doing this, you're missing a huge advantage of marketing the program.